My apologies. I muted here. I had a phone call just now. So let me just go this over. Yeah, okay, yeah, okay, yeah. All right, sorry, my apologies. Let me just okay, just do it over here. Right. So slide number 14 essentially is the summary slide of all that we're going to do ahead, coming up ahead, which is um, how we go about with self-management planning for our patients. We assess the patient, we advise the patient, we agree with the patient on what we want to do, what we want to get done. It feeds into a personal action plan. Then we assist the patient with strategies and techniques that they can use to ensure that their action plan is going along fine, and they are, we're giving them ideas and strategies and to help monitor their disease status. And then we can have arrangements such as phone calls, WhatsApp, um, emails, sharing of information, sharing of information so that they can again continue having better control of their disease status. All right, so assess is I was saying risk factors and beliefs. I spoke about religious beliefs. Then I spoke about risk factors that would include sometimes the social determinants of health as well can be a risk factor in in when you make your assessment of the patient, their behavior, their knowledge, sometimes their educational level, their behavior, meaning if it is that they might be, they if it is they are high energy individuals, if they may have a history of erratic behavior, all of these things form part of the assessment. And you look at the knowledge, the skills, the confidence, the support, the barriers, and there is a metric applied to this as well, a confidence ruler that you can use now to score on the assessing component. How confident are you that you can control your symptoms or health problems and that they do not interfere with things that they do? So that this can now tell you, give you a metric on the assessment component of the patient. And you want to be provide feedback to the patient and assess the progress and view the progress of the patient as it relates to goals. Then we have advice. You want to provide specific health information about the risks and the benefits of the changes. Make sure you provide your advice in a very clear manner, communicate it well, and I'm reminding everyone again, your communication must be on point. Your communication must be the 70-30 rule applies, 70% nonverbal, 30% verbal. All right, in the manner in which you go about it. Remember, this is self-management care. This is not patient education. So your approach must be different. Your approach must be one that is comfortable, one that would facilitate the patient speaking to you and not being afraid to say things to you when they fully accept and understand that they are in they emphasizing their role in the management of their care. Tailor the information to the person and the environment. Listen more than you talk. I know as healthcare professionals it might be difficult for us to listen actively, but for self-management support, it's important that you listen. And even beyond self-management support, as a healthcare practitioner, listening to what the patient has to say would give you cues and clues that can guide you on your decision making for the patient. Agree. Then we have to now collaboratively agree on the selected goals and the treatments. And again, you have the confidence ruler in there to give a metric to the process where the patient who can now score on themselves how much they agree that these things that we are going to do will actually produce better results for my illness. And then we can look at the personal action plan. We're on slide number 25 now. Something you want to do. Describe the how, what, when, where, frequency. The barriers that exist for the patient being able to actively and correctly take control of their health. And then there's and plans to work with the patient to overcome these barriers. And then there's a confidence rating as well, a metric that is tied into this as well. So you can now score on how confident the patient is in being able to agree that the steps they're going to take will produce the desired results. Right? And you see your agreement can have some more metrics in it, goals to achieve in 3 to 6 months. You know, remember smart with respect to your goals and objectives. So it must be appreciated by the patient about the type of goals that they have to achieve. Assist, do what you can to assist the patient. Share with the patient techniques that they would not be familiar with. Share with the patient techniques that you may have seen elsewhere or that have been successful with other similar type groups, social and environment groups. Problem solve. Solve problems that patients are bringing up. Problems would include the barriers that we spoke about earlier. All right. Allow the patient some at times to come up with solutions to their problems, or collectively you both come up with solutions to their problems, and you have solution A, solution B, solution C. You try one and see if it works. If it doesn't work, you move on to the other possible solution. And then we have some examples here of of individual examples of where this was tried in Glasgow and in certain clinics. Right? So those are just examples. And then we again talking about patient empowerment, emphasizing the whole patient, the patient generating the options, building on strengths, understanding that failures are learning experiences. You have a real important role in explaining to the patient that uh, in an attempt to take control, you may be using a particular medication. That medication may not work, and that's okay. You have to now and emphasize to the patient that medicine is not an exact science, and each person's bodies are unique. And whereas, let's just say, for example, a simple metformin might work for majority of patients, but for you, it may be causing too much of issues that we may have to look at an alternative. Understand that the failure of medication or the failure of approach is a learning experience for us to learn and grow. And the end result and the person who's winning at the end is the patient. All right, so some techniques that we use will be motivational interviewing, problem solving, empowerment, as we spoke about. Skill acquisition. Sometimes you might need to encourage your patients to develop skills to go out there and get training in certain skills that are related to their healthcare condition. All right, and then with thoughts on the reading level would be similar to the educational level of the patient. Arrange, arranging for follow-up, for monitoring, for being vigilant with your patients, pharmacovigilance. So the opportunities that exist would before the encounter, during the encounter, and after the encounter. Before the encounter, you could get a pre-visit phone call. I know that some clinics, some private clinics do this. They call the patients in advance, not just only for a reminder, but they call the patients to let them know that to see how they're going and to let them know that they have an upcoming appointment and if they will be able to make it or not. Community outreach. During the encounter, you look at the 5 A's again: the assess, the arrange, the assist, the assess, advise, arrange, assess, advise, agree, assist, and arrange. The 5 A's. And we want a philosophical shift from that large gap that exists between the professional and the patient, that gap to now slowly get smaller, smaller. So now it moves from a large gap between the professional and the patient to now it's now seen as two persons, not professional, not patient, but two persons interacting with each other for the benefit of individuals achieving their goals. So the patient sees themselves as an individual, the professional, the medical professional sees him or herself as an individual that are now working together for the outcome, for the general outcome of the patient, as well as a healthcare practitioner. Now, by doing this, it's now going to reduce the burden, it's now going to reduce the workload on your clinics as well. So that, students, is self-care management support. It is the direction that we would want to go to. It's something that should be employed a little more, a lot more in your public healthcare institutions. As pharmacists, you do have a role that you can play. Your role is education, 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 and your ability to communicate and educate your patients can go a long way in ensuring that they now empower themselves to take full control of their chronic disease in particular. All right, so that's it for self management support. Any questions, queries? Yes, Karina, one time. When is our next assignment? You're missing at all. Um, your next assignment, I think there is a little review that you all will have to do that might be due most likely on the 2nd, and your next assignment should be on the 16th, so that I can finish grading on time for you to have your results, your in-course assessment results before final exam. So that should be your lit review should be in the week of the 2nd, and then the following week should be your in-course assignment, your second in-course. Unless Dr. Murad wants you all to do lit review next week. Um, and right, so the week of the 2nd should be the lit review. The 16th should be the in-course, and then that should be there. So this is actually our final. Samantha, see, what's the question mark about? Um, so this is our final lecture. What we're going to do next week, I will take the first hour to review your first in-course assignment, and then the next hour we will start to review all the lectures we've done. We may have another session to continue reviews and to take questions and to have lively discussion on the topics at hand, so you can be better prepared for your final exam. I think you all have lit review. You all have lit review for this course and farm admin, most likely. The community students have a business plan to get done. Farm admin and this course have a lit review. Yes, Dylan. Uh, Samantha, see, right. Marie, you find the first exam was hard. Well, you have to remember, you have to understand that as students, you all have an opportunity to do exams open book with lectures available. Nobody's supervising. Nobody's watching. So we can't give away the degree, right? Remember, we have two exams with 10% each, right? So that's the first in course and the second in course, and then the lit review is 15%. Correct, Karina? And then attendance is 5%. Attendance and participation is 5%. You all getting that? You all have to make up things to the COVID part, Marie. Oh, Kai, you're present. Kai. What about Jahil? I didn't see Jahil this morning in community, and I'm not seeing him here. Um, so Yes, remember we are in a pandemic, so it would be obvious that we want your thinking to be pandemic related as well. Chelsea present. So the question was a bit challenging. Yeah, but I have to make the Oh, Jahil. Well, I want to know, Jahil, you're vexed. Why you quiet this morning? What happened? Vikash, what happened to both of you in community this morning and in this class as well? What's going on, fellas? There wasn't a lot of Google info. The point is, I want you all to develop your critical thinking skills. Me and really like my way. Jahir, I am sorry. I am sorry. I understand that you didn't like your grade, or those of you who didn't like your grade, but remember, I have to be as fair as possible, and the reality is that there were other students who answered the questions properly. So it's a learning point. It's a learning experience. Nothing is wrong with failure. Who is Jamal? Oh, Zara. Okay, okay. Yes, Jahil. I know you know, and I was actually, as I said, there was some students did well in one question and didn't do well in the others. There were some students who did okay in one question and didn't do so well in the others. So that's how it is. Hi, Zara. Welcome to class. You have a lot of catching up to do. You have a lot of catching up to do. You should be on the WhatsApp group. I hope you are. If you're not, try and get on the WhatsApp group so that you can get yourself acquainted with all of the lectures, and you can get my number from the group and ask questions. Vikash, which course we talking about? I didn't do Instias yet. I did farm admin and I did community. Yes, I understand it's not your fault, Zara, but hopefully you'll catch up on them. I'll most likely have to give you a separate exam. Yes, the communication course exam grades, I have about 8 more students to correct, but I have it in Excel sheet and I'm going to put it up on my learning later. All right. So Jahil, sorry, brother, but see it as as an opportunity to learn. See where you ask questions where you may have gone off. You can perhaps talk to some of your classmates who may have scored well or scored better than you, so you can see how they approach the exam. All right. So if no more questions for today, I'll see you all next week where we will review the first in course, and hopefully I can get through corrected most of those grades, and then we shall start reviewing all of the lectures in preparation for your final exams. All right. All right, guys and gals, gals and guys. See you all next week. Have a good day. Have a good week.